Hey, my name is Musa and this is my Capstone senior project. I went with the name Casting a Light on Medicine because my goal was to enlighten myself on the whole field of medicine and figure out more about what it means to be a physician. So for my goal was I wanted to end up shadowing as many doctors as possible in the time I was given, which was 25 hours. And my goal to make the product was make a list of what I think what type of personalities would fit what doctor archetypes. So one of the harder parts was the research. I had to navigate the field and I had to figure out what what can I even do to shadow, and that stood out to be a very big challenge. And then picking the specialty was big for me because I knew I want to go into orthopedics. Orthopedics is something I know I'm going to do in the future, but also go into other specialties because you can't obviously just do what you want. You got to go into ENT, radiology. You got to be able to experience all the specialties to have an unbiased view of everything. And so for me, I got lucky and I was able to meet Dr. Willard at Orthopedic One. And I met him through a connection because sending emails and going to offices just doesn't work, especially when it comes to the medical field and shadowing. Connections is going to be your best friend in all of it. People, just the bureaucratics behind it is just too difficult. And then Dr. Willard was able to get me to Dr. Nash, and then they both got me into the hospital, which I was able to meet more doctors and figure out their experiences. So Dr. Willard was an orthopedic surgeon, and Dr. Nash is an ENT specialist or ear, nose, and throat. So they're on two completely different sides of the spectrum. And so something I had to learn was the etiquette of shadowing, learning that when I'm coming into the office, what time I gotta be there, the clothes I gotta wear, how I'm talking to the patients, how I'm communicating with the doctors, when it's okay to take notes, when it's not. That was a very big thing for me, and it's a lot more difficult than I thought it would be because some patients want this, some patients want that, some people don't want you in the room. It changes like all the time. And so the experiences that I had was the biggest challenge that I found was, especially in the orthopedic office, you'll have people coming in and the issue is these are mainly older people and they're having a lot of pain sometimes. And sometimes, not to sound rude, but it's kind of funny. Like, I mean, if the guy's like in the office and he's screaming, he's like, he's just over exaggerating because maybe they're trying to be funny. You got to keep your composure. So is the doctor. You can't give a reaction. And another tough thing is sometimes the patients look to you like there's a doctor and then there's the student. They take you as another medical professional, and you have to know that I can't be answering questions. If they ask me something, unless it's personal about myself and I can answer it, I should not. And then quickly learning what motivates a lot of these doctors and physicians to do what they do. Like, for example, I met a trauma surgeon named Dr. Wong, and his complete motivation was completely different than everyone else's. I mean, Dr. Wong would come into the office completely angry. He's late. Honestly, I didn't think he was a doctor the first time I saw him. I mean, he just looked like some guy who just did not want to be there. But it turns out he's one of the top surgeons in Central Ohio. He just hates to be in the office because he's a trauma surgeon. I mean, he loves the rush, and I saw him in the hospital a week later, and he looked like a completely different person. And on the other end of the spectrum, we have Dr. Nash, for example. He's an ENT specialist. He likes the low pressure jobs where there's nothing going on, really, no adrenaline, but he likes those patient interactions. And then, so my most favorite memory from the experience of shadowing was when I got to go into surgery, which became a weekly occurrence through, I want to say, early March, early March or late February. I was in the hospital a lot, getting a lot of surgical experience and seeing what's going on, and it really is crazy when you get in there. And so my final product led me to this. So I had the simple socializer, an architect, the empath, and the thrill seeker. And so simple socializer, like Dr. Nash, is someone who is more there for the patient experience, like communication. They like talking. They don't really want to do anything that's too high intensity, but they still want to help. The architect tend to be people like neurosurgeons or rheumatologists or maybe like orthopedics who they're more fascinated with the way the body works, and they're more on the like personal side. They care more about just manipulating and being able to change the body to help out other people. And then we have the empath, people like psychologists or gynecologists, people who are big on the patient interactions. They have usually tighter bonds with their patients. And then we have thrill seekers, like I said, like Dr. Wong, someone like a trauma surgeon, someone like a general surgeon, someone like emergency medicine. Those guys tend to fall into that field. And of course, you can be a mixture of both. And I have some of those here, like we have family doctor, which is a mixture of a simple socializer and an empath. Or then like on the bottom side, neurosurgery could also fall into the architect mindset, but it's mainly a thrill seeker because that's emergency medicine. My notes, took a lot of notes with the doctors. A big takeaway I had is that a lot of these doctors, they love their jobs, and the field, they went into the field because they love their job. And so the main thing I noticed is whenever I was shadowing, a lot of the times they would share a lot more information than I needed or that I could ever ask for. I mean, I would be in the office, and before, when a patient's coming in, he asked me to look at this x-ray and he asked me what do I think about it. And obviously I don't know what's going on, I'm not a doctor. But I'll give a guess, and then he'll say, well, no, this is what it is. And he'll show me, and he'll explain. And that's where the majority of my notes are, or information that the doctor was sharing with me about medicine. And then also some lifestyle stuff, like how his life is, what he thinks about this. I mean, time that he has home, but that went into more of this. A lot of my notes, majority, is stuff like stem cell treatment, what causes arthritis, what is osteoporosis, stuff like that. Any questions?
What was your worst, like the worst moment of it?
The worst moment? The worst moment, like the nastiest or like the emotionally worst? Like emotion. Both. The nastiest moment was when I first went to surgery. I was not prepared for how bad orthopedic surgery gets. Like, I mean, when they cut open the knee, it's just straight hammering into the femur. So there's blood going everywhere. I got a lot more blood on me than I ever could have expected. I mean, it was all over my scrubs. It was all over my shoes. There was a lot of blood. That was surprising. I mean, I wasn't ready for that. And emotionally, just like, I mean, not bad for me, but like, I mean, what do you do when a guy comes into your house and like, he's having back pain and like the doctor touches it and he's like, ah! Like but you gotta sit there and not laugh. Like you can't even make a face. Like you just gotta sit there. I mean, it's kind of rough. It can be kind of rough sometimes. Anything else?
What field did you like the most?
Definitely orthopedics. I mean, orthopedics is, I've always known I want to go into it, but like working with bones and athletes mainly is my goal in life. And orthopedics is the one where I only saw really the most athletes. And being able to help people get through surgery and rehab and their injuries from football, wrestling, soccer, whatever it is, that's definitely my goal in life. All right, perfect.
Wait.
You got a question?
Yeah. Did you meet anyone?
Like doctors, what type
Yeah.
of people? Oh, I mean, yeah, that's all my shadowing was with doctors. So time I spent shadowing in the hospital was predominantly, honestly, it was only with the doctor. So if I was shadowing, there was always a doctor next to me. I was talking to them. They were either, I mean, a lot of them got to sign me a lot of letters of recommendation for college. So that's, I mean, I made a lot of really useful connections throughout this experience.